Good morning, ladies and gentlemen. Thank you all for finding time to be with us this morning to discuss what is a critical issue for many of our states and definitely for the world at large. We are focusing this morning on the next frontier in global financing, high-impact health solutions for women and children. But I really want us to have a human conversation today. How many of you saw the video yesterday at the MSc event in the evening? 3-minute video. For those of you that didn't see, how many were tearful? For those of you that didn't see it, you need to see it, and it will be on the MSD website. It follows the journey of 3 women going through pregnancy. One is a woman who seems to be in Europe or in a Western country, fairly good conditions. One seems to be in India, and the other in Africa. And it's really quite a stark difference, the experience they go through. Why are we here today? We're here to ask ourselves, how do we invest in such a way that it makes a true difference on the ground? Just to make the point once again, I'm a mother and I've given birth 5 times. I've had 5 children. My first pregnancy was safe. My second was safe. My third, fourth, and fifth, I would have lost my life. As I sit here today, I'm very clear that I'm alive because I got access to healthcare. But there's so many other mothers losing their lives, and there is something wrong with that. I want to recognize and thank our hosts this morning. MSD for Mothers, thank you so much. GFF, hosted by the World Bank, thank you all so much for investing. On our panel also, as you see this morning, we have the Bill and Melinda Gates Foundation represented, and thank you to all of you for being here this morning as well. We're going to go straight into our discussion. They really don't need much of an introduction, so I won't go into profiles. I will, however, mention that we have 2 representatives here from the government of Norway and the government of Canada as well, and we want to recognize and appreciate them, and we'll be hearing from them as well in just a short while. But let's get started, let's get straight into it. We begin with context setting. President Kim, in terms of the World Bank and its participation in the GFF, it was created to help countries improve the health of women and children, but how does it represent a different model? And what should we all be doing to be part of the change?
Well, Julie, thanks you. Thanks very much. You know, Julie, the argument and the rationale behind investing in health and education and what some call human capital is so clear. It's just so clear. And there's I think when Larry Summers did the Lancet report, I heard him speak about it once, and he said that, in fact, if you're in a developing country and you don't invest in health, it's because you can't count. Right? So, in his usually diplomatic way, Larry made it really, really clear. And I'm so glad he says it that way because it's true. The numbers are just overwhelming. But the problem is that there's a huge shortfall, 33 billion in shortfall, and it's very difficult from our perspective to get countries, when they look at their overall allotment of financing, even concessional financing that comes at very good terms, but that you still have to pay back, they're not choosing to spend it on health and education. Now, you know, we have to change that in a much broader way. But with the GFF, we're really closing the gap, and now countries are really stepping forward. We have 16 countries that now are engaged in getting programs started. And you know, I think over time, this is going to allow us to have a much larger impact. We are able to leverage 4 to 5 to 1. So for every dollar that we receive, and mostly it's been, you know, I see Bill and Borge here, the dollars have been leveraged, I think, very effectively. The programs are going to go forward. But what it reflects is partly a problem. We really have a problem right now in terms of helping countries to understand what it is that they should invest in. So one of the things that I've been doing this past week is that we have got to maximize resources for development. So for example, we spent quite a few sessions with investors and talked to them about how there are so many projects in developing countries that could be funded with private sector money. And so we need to be very disciplined and say if something can be funded with private sector money, Airports are classic. Ports, even toll roads are being built with private sector money. And generally speaking, even though there's so much money that's earning almost no return, $12 trillion or so in that area, in negative interest rate bonds. So investors are paying people to hold their money to the tune of $12 trillion. We can crowd that in and then start paying for those things that countries are now taking sovereign loans for. I think what that will do is open up that space. So we hope it'll open up the space. And then we're going to make a very strong case that you've got to invest in the health, especially of mothers and children. This is a huge start. It's going to get people starting to think much, much more about the importance of investing in the health of women and children. And I think over time, it will be the key to countries being able to compete. I mean, what we're talking about here is the fourth industrial revolution. And what we're seeing is that the lack of investment in children, and you can see it in stunting levels, poor educational outcomes, is actually setting up countries for, I fear, instability. If you have 38% stunting in India, if you have 45% stunting in Pakistan, very high levels throughout Africa, once the fourth industrial revolution hits and all the low-skilled jobs, or so many of the low-skilled jobs are gone, what are those children going to do in the future? Right. So this is urgent, and it's instead of just sitting around saying, please, please do it, the GFF it offers such an attractive inducement that now we're seeing countries move finally in doing much, much more on the health of women and children.
So it's a critical issue. It has long-term implications, but also, while we see this as a health issue, in many ways it's an economic issue as well. In a lot of homes, when you lose the mother, the impact economically is felt for generations to come. It's a social issue as well. I'm delighted to announce that just this morning, MSD for Mothers has made a $10 million investment into this, and is the first private sector organization to step up and do this. Chairman and CEO Ken Frazier, why have you stepped up? What is the role MSD is playing here, and what's your message for other corporates?
So first of all, let me say good morning to everyone, and I will say that we're very pleased and proud to have an opportunity to work alongside people in the GFF. You know, as a company that's committed to health, we see the fight against preventable maternal deaths as something that's core to what we do as a company. Every 2 minutes, as you know, around the world, a woman dies unnecessarily from complications of pregnancy. And we have an opportunity to do something. And through MSD for Mothers, our 10-year, $500 million commitment to this area, we've been able to provide thus far, starting from a standing start, 6 million women now have access to contraceptives and quality maternal care. So what does that mean, for example? In 2 countries, Zambia and Uganda, in less than 2 years, we've been able, in the affected regions, to reduce maternal mortality by 50%. That's a lot of unnecessary deaths prevented. In Senegal, with respect to contraceptives, in less than a year, we've been able to take stockouts of contraceptives from 80% down to nearly 0. So these are problems that are difficult. As you said, when a woman dies unnecessarily, the impact on her community, on her family is devastating. But the sad thing about this is that these are things that can be actually prevented with the right kind of intervention. And the key to intervention, of course, is partnership. And we're just pleased to have an opportunity to partner with Bill and Melinda Gates Foundation, with the World Bank and others, so that we can leverage our respective skills to do something about this horrible tragedy.
Thank you, Ken. You know, so much has been achieved. As a result of the Millennium Development Goals, we have moved forward, but there's still so much to be done. Bill, as I come to you, how do we ensure that we are being more innovative in the way that we are effecting transformation? How can we have innovative models of finance? What do you suggest?
Well, financing primary health care and these interventions that make such a difference, it's a huge problem. Here at Davos, Gavi was created, and so there's a piece of that in terms of getting low-cost vaccines out to kids that actually the world has done a good job. But when you look at the other pieces, the primary health care funding, the high-quality supply chains that need to be integrated, we fall way short. And you know, it's a shame that it's purely an economic thing. So every new donation, every new idea that comes along that can help fill the gap there, we applaud. We do a lot with Merck, Merck MSD. You know, and this, to really win, you have to have great new tools, you know, like the HPV vaccine and a great delivery system. And both of those things are very hard to do. GFF, which we're a partner in, along with Canada and Norway and hopefully many others, now Merck, is encouraging, as Jim said, countries to prioritize health financing. There's been a number of countries that have combined their IDA eligibility with the GFF money and come up with financed aggressive plans that are very measurable in terms of infant lives saved and mother's lives saved, nutrition, reproductive health, all the key things people have talked about here. GFF prioritizes those things and helps them plan the right way to do it. So we need more. There is progress. Maternal deaths, you know, did come down, not as much as was hoped. It's a hard one because in some cases you have to get women to a facility, and having a well-run, well-staffed facility is still out of reach, particularly for the rural population in a lot of the developing countries.
Right. I mean, you know, we have seen remarkable work being done around midwives as well in communities, ensuring that they do have the skills to do what needs to be done on the ground, but access to clinics and healthcare facilities absolutely critical. I want to just refer to a statement now from our representative from Senegal, who could not make it today, of course, because of the situation that is ongoing within the West African region. Very sadly, she has shared her comments with us. Minister Kolsek sends this message. She says, "I'm very sorry not to be able to join you today as planned due to the crisis in the Gambia impacting already in Senegal with more than 35,000 displaced people." But she shares their experience. And just to highlight a couple of things she has said. She says, thanks to public-private partnerships, to the BMG Foundation, MSD for Mothers, and the Ministry of Health in Senegal, they have improved the distribution to health facilities up to the last mile. And inspired by practices of the supply chain system used by private pharmacies, the whole country is now covered with less than 2% of stockouts for contraceptives reported nationwide. Less than 2% is pretty remarkable. She says, through innovation, and innovative financing models like GFF, we have had the opportunity to scale and sustain this program, extending it to even 200 essential medicines countrywide, getting to the people. So change is happening. Progress is being effected. But Bill, let me come back to you and just ask the question. When we look at the SDGs and the challenge that we have set for ourselves, can we really work together and step up, or are we frankly being a little bit too ambitious?
Well, the SDGs, some of them are going to be hard to reach. For us, the core SDGs are really the continuation of the MDGs. And the primary role of health and nutrition really, you know, came through the need to focus on women. One thing the SDGs do is they uncover best practices. There are countries like a Sri Lanka or Rwanda that, relative to their wealth, both because they prioritize health and they execute well, they achieve amazing results that are equivalent to countries that are 4 or 5 times as rich as they are. And so the SDG process, although we sometimes don't meet the ambitious goal, the kind of comparison that goes on, where we find the positive outliers, unfortunately we find also some negative outliers where the primary health care or vaccine delivery system is completely broken down. Partly it can be supply chain, it can be cold chain, it can be the financing gets confused, so the goods aren't ordered in time to get them out there. The SDG frames this work and allows all of us to go to country leaders and say, hey, your country is behind on these things. We wish the democratic process would always prioritize these things. People would run on, maternal lives saved, but sometimes
Sadly,
it takes outside voices to come in and, talk about what needs to be done. So the SDG framework brings us all together to measure things in a common way.
Okay, so it is playing a key role in giving us direction and focus moving forward, is what you're saying. Dr. Kim, if the GFF had greater finances, what could it achieve in this space?
You know, to sort of pick up on where Bill left off, the SDGs are just stunning. I mean, it was described to me as the absolute perfect UN process, meaning that everyone contributed. And at one point, I had suggested literally typographical corrections, and David Nabarro, who's in the audience, remembers these discussions. And I said, this is just a typo. You can't eradicate tuberculosis unless you kill all the people who are living with the bug. And they said, no, you can't change that word. And I said, what do you mean? What do you mean? I said, if we change one word, then the whole thing gets renegotiated. Because every word of it was negotiated by every single member state, and you change one word, everything goes out the window. So it's this incredible document, and I think it actually reflects the reality of today. Meaning, as I go around the world, one of the biggest changes happened were smartphones, and people are aware now of how other people live, what the world is like. And so you now have 7 billion people in the world with aspirations of living sort of a more or less middle-class lifestyle. Maybe not everybody, but a huge number. And so the SDGs actually reflect that. And so in response, what we turned around and we said, oh my God, then we have to think completely differently about financing. And so we wrote this document called Billions to Trillions. And billions to trillions means you take every single available dollar and stretch it as much as possible to cover as many people as possible. So in this particular case, what we hope that the Gates Foundation and Canada and Norway and now the Merck, I'm always knowing you guys as Merck, sorry. Yeah, Merck.
We don't mind. There are others who do.
Sorry. When Ken and I were speaking, Ken's mentor was Roy Vagelos, the great man who donated Mectizan, and we had great admiration for them. So anyway, the donors, what we're hoping is that you could give that money as a grant, or you could give it to the GFF and multiply it 4 or 5 times. And then, and because now again, because it reaches the level of concessionality that now governments are ready to move, that balance is what makes this so important. Now, if you they are taking on indebtedness, but the terms are so generous that it's definitely not going to affect their overall space to take loans, and it's the right thing to do. And so, what we hope is that this is where we go. That every single donor starts asking the question: now, wait a minute. If I can amplify my impact 4 or 5 times, and you have the World Bank and the IMF and others watching very carefully to make sure that the debt to GDP ratio doesn't go up too high, what a great idea. Why would we not do that? Why would we not make a donation that can be stretched like that? And I'm going to be struck down for saying this, but we're actually having discussions with the Global Fund right now, the Global Fund to fight HSP and malaria, because, for example, the Global Fund is giving grant money to Indonesia and India, and Indonesians and Indians are asking us, well, why don't we leverage this? And if we multiply it 4 times, we could actually build systems that would last instead of just using the money to buy drugs. Now, that hasn't been done yet. I see my buddy Asi, who was one of the originators or the founders of the Global Fund. But I think that when you have 7 billion people with such high aspirations, you've just got to be as creative as you can possibly be to stretch the resources. And so there's got to be win-wins. So for the private sector, what we're saying is, look, you're paying these people to hold your money. Why don't you work with us and invest in a port or a road or something in a developing country that will actually give you a return over 10 to 15 years? Their response is, yeah, but it's too risky. And we asked them, well, do you understand the differential risks in each African country? And they said, no. It's just all risky. Right? So what we're doing now is we're going to do everything we can to use our capital. Instead of just giving the money for the loan, we're going to use it to help de-risk entire countries, better policies, even going to the point of putting in risk capital. In other words, first loss capital is if the project goes apart, we'll take some chunk of the loss, and then the others can actually have a better chance of recovering their money. Now we're seeing insurance companies and even pension funds that are so conservative beginning to talk to us about that. And the reason I mentioned that is because that's going to be the key to achieving what we want to achieve in the area of health. Because then the countries will say, oh, I see. So we don't have to provide sovereign guarantees for that stuff. Then we can really focus on the human capital investments. That's the vision that we hope to see. And for all the people in the audience who are thinking about this, why would you not take the money that you're using and multiply it 4 to 5 times to have a much larger impact?
So why would you not do it? That's the question. And again, it's the right thing to do, which is absolutely critical. Ken, the buzzword around public-private partnerships, you know, everyone's talking about this, but the bottom line for MSD, why engage, and what message would you have? Because we want to see other private sector players get on board. What message do you have for them?
So first of all, doing the GFF is a natural fit because they are targeting the countries of greatest need and working with the governments that are trying to get things done on the ground. So let me tell you why we think this is so important. We're very proud of our history as a company. Our core skill set is developing medicines and vaccines, and we've been able to have huge impact over 125 years, recently developing an Ebola vaccine, for example, something that we're very proud of. But just developing those medicines in isolation, we have found, doesn't get them to the people that we need. So we have to imagine these health problems, as Bill said earlier, very broadly. We have to think about how we're going to provide primary care health support. We have to work with different people who have very different skill sets. We bring our own skill sets to the table. So for example, in this area, we're running a 30,000 person clinical trial trying to develop a heat-stable version of carbetocin. That's sort of our sweet spot. But at the end of the day, if we're really going to have the impact that we want to have on these women and these children, it's not enough to be a company that develops vaccines and medicines. We have to work with others in the financing area and the health delivery area to ensure that, again, that we reimagine solutions in the broadest way and target those solutions to a way that actually has the greatest impact. And that's why we are so pleased to have these partners, because we know that we can't do it alone.
Thank you. I want to recognize now, I mentioned them earlier, but I want to welcome 2 special leaders who are with us today. Their nations have demonstrated really strong commitment to GFF. We talked about the importance of having diverse collaborators come together. And I'd like to introduce you to the ministers from Canada and Norway. We have with us William Francis Morneau, who is Minister of Finance Canada, and we have Borge Brende, Minister of Foreign Affairs of Norway. Did I say it right? Almost no, but okay. Okay.
There are more important issues.
Thank you. Let's give the floor to each of them. And William, I think we'll start with you. The Canadian experience. Please do stand up and take your space. Yes. And share with us your engagement, what it means, why, and the message you would have to others.
Well, first of all, just to play off a little bit of what's been said here today so far, we would love to run for office saying that what we're going to do is we're going to focus on maternal health in other countries. It might not work. So we have to communicate some other things. And we successfully communicated a number of things to Canadians about what we would do in Canada. Part of that was being engaged in the world and having an impact in the world. And this is one of those ways that we think we can have an impact. But coming to what President Kim was talking about, our ability to actually communicate to our population the impact we're going to have is going to be so much more impactful if we're able to say that we're spending $1 and we're having $5 worth of impact. So we started out when we went to our population and said, we really believe that focusing on public-private partnerships is going to be impactful in our own country. We believe that if we're going to do the things in our own country that are going to have an impact, we need to catalyze the impact of the private sector and create confidence that will make a real difference. So when we look at the Sustainable Development Goals and how we can actually get to those pretty audacious goals, we see the impact of official development assistance, but we recognize that needs to be a way of catalyzing further investment. So for us, the global financing facility is about a mechanism to do that, and it's about how we're actually going to execute on that. For me as a finance minister, I can say that if I can actually see that we're having a much greater impact on every dollar that we spend, then it's much easier to move forward with the next investment and the next investment after that. So that's really, from our standpoint, why this is such an important initiative. Getting organizations like Merck or MSD as part of this initiative is, again, another way to amplify the impact of every dollar that we put forward. So from Canada's standpoint, this is a really important way of having an impact, and on an issue that, in fact, we will be proud to go back to Canadians and say we are part of an initiative to make a difference on maternal health for children. And we did it in a way that was able to ensure that we didn't spend as much as we might have spent as if we used every dollar from the public coffers, that we found other ways to do it. So really, really pleased to be part of this initiative.
Thank you.
Thank you so much. And I think with the global realities we face, the world will be looking to Canada more and more. Thank you. Thank you very much. Minister Brende, please, the floor is yours. Why did Norway, right from the get-go, step up? Why is this important, and what's your message to others?
Thank you. To reach the Sustainable Development Goals, I think we all agree that the prerequisite is that we also succeed when it comes to every woman, every child. So if we don't get the healthcare system working, we will see new examples of Ebola and etc. So that is the overall vision. It should be common sense, but it's not always that common, even in this field. And then there are ways of reaching that goal. And GFF is, in my view, an innovative tool and the best tool available. That's why my ministry also have committed to $350 million in the coming years to this facility. But what is really important for me with this, in addition to what is said, is that we really want economies that are moving from being developing countries to middle-income countries to also build the capacity to increase their domestic revenue. This is what all ADIS was about, financing for development, because there is a huge capacity now in many developing countries also to make a priority of what is important. We know that in countries, 50% of the state budget goes to military purposes. And when the taxes amount to 10% of GDP, in Norway it's a little bit more, to put it that way. Something has to change with the system. So we have to incentivize also domestic resource mobilization. I think that is a good thing with the GFF. Because is there something more important for a government to invest in than in children and pregnant women, education and health? No. First you have to do that, and then you can look at other things to invest in. So I like that piece. We also like what Jim said, that why aren't you investing in funds where that can leverage and where you can get 3 to 5 times more effect of it? I think as a political leader, I have to have good arguments putting things in the, for example, budgetary support when the alternative is going to the bank, and you can, together also with the private sector, governmental money and the bank, you can leverage, and then you can reach 3 to 5 times so many people. So this is in many ways ticking off all the things that we think is crucial, meeting the SDGs, eradicate all extreme poverty by 2030, doing it also by having a real focus on health and education, and using the most innovative modern tools available to reach the goal. It's like, you know, we are at the most important breakfast in Davos today. Thank you.
Thank you. Thank you. I'm coming to the floor now for questions and comments, but I host a show called Africa Leadership Dialogues, and I always love to share African proverbs. And the minister just said, is there anything more important than investing in women and children? There's an African proverb that goes, looking at a king's mouth one would never think he suckled on his mother's breast. Right? Let's stop being those kings. It's a little bit racy, but it's so true. Let's stop being those kings who distance themselves from the things that are important, and we don't know where we all came from, and at the end of the day, what matters. So with that, I'm opening this to the floor, and I see that we don't have any gender balance here. So I will ask if there are any ladies with questions. I'll start with you. So do we have any ladies in the room who... Are you? Yes, I could see you were. Yes, go ahead. Thank you.
My name is Katja Iversen. I'm the President and CEO of Women Deliver. And as some of you have heard me say before, women deliver and so much more than babies.
Yes.
So I enjoy this debate a lot because when we know that when you invest in girls and women, there's a ripple effect and everybody wins. So linking the discussion we have today with the discussion about gender equality that's happening in another room today about when you kind of invest in gender equality, it's a big McKinsey report that's coming out right now. It really, and particularly health as well. It pays back so much. So looking at the GFF and the health, but linking it to gender equality, what's going to happen on that account?
Can I start by saying that I think one important element of that, and Bill and Melinda Gates Foundation has been very instrumental in this, is providing women with the ability to decide when and where they want to have babies. And so contraceptives and the general availability of contraceptives, I think, is a big, important issue as you travel around the world, whether you're talking about women or you're in Ethiopia where you have, for example, child brides, and these women in their teens are giving birth to children with all kinds of impact on their own health. I think that's a very important aspect of this, is to allow women the degree of control over their own reproductive freedom, and therefore the space to develop educationally, to develop in terms of businesses, etc.
Okay. Bill, Jim, would you like to add to that?
No, Melinda is very passionate about these things. She's in Nigeria today studying our reproductive health efforts there. Not an easy place to do what, together with Merck, we did in Senegal, but the goal is total access. And we do now have good numbers where we go out on a regular basis. And so instead of restating the principles, we can actually have the report card country by country of where there are women who want tools of contraception and they're not getting it, and understanding what that experience is like.
Thank you. Jim?
Well, last night I was at a dinner, and Sheryl Sandberg from Facebook was saying, there was this pretty straightforward question asked, are we making progress on gender equality? And she said, as far as I can tell, no. And she was specifically looking at leadership positions, and so she went through the whole list of, how many heads of state, and she was saying no. And then, interestingly, some of the business leaders around the table said, but wait a minute, here's what we've been trying to do. And what they kept saying was the only way that you can change the culture is if you truly believe that having women in every position moving forward and is going to make your company better. Right? And so we've been publishing study after study after study that says that greater participation of women in the workforce, plus the support for them to be able to do that, will raise your GDP by very significant points. But again, this is not enough to change culture. And so what they kept saying is you've just got to believe that you're doing this because it's going to actually make you more profitable. And so one of the companies, I think it was AT&T, was saying, we actually now insist that in the cohorts where we're feeding, that are feeding into top leadership, that we insist that 60 to 70% are women, right? And so the question was, are quotas important? And Sheryl said something very interesting. She said, well, the quotas are important, and if you put quotas in place, you'll reach that quota. But we haven't seen that spreads to other things. So if you say that all boards have to have 30% women, you'll have 30% women on the board, and then 5% on everything else, right? So where we start is exactly where Bill said. If we don't start with saying every single woman in every single country at least should have health care, should be supported during pregnancy. And then also should be supported as she cares for her children. I mean, some of the projects that we do with this money are pretty straightforward, like skin-to-skin contact between mothers and their children, which has been shown to have a huge impact. So this, we're not like building CT scanners with this. This is very basic stuff. And if we put all those things in place, at least we have that. The task of changing culture in some of the places that I've worked is a bigger one, but we just got to keep at it.
Yes, and then just emphasizing that changing culture also involves, in many countries, fighting patriarchal societies
Yes.
and getting the men on board and realizing we've got to do this together. I'll come to, I see several hands up. I'll come to all of you. I'll start with you, Sid, and then I'll come to the gentleman over here. Sid, Sid is, sorry.
Raise your hand high.
Yes.
Let your voice be heard.
I see you. Okay, I see you as well. I'll come to you as well. Sid, what we've just been discussing, very difficult cultures that have practices that impact very negatively, child brides. We're seeing a lot of lost lives, preventable deaths. What work have you been doing, and who are the partners involved, and what's the impact?
Thanks, Julie. First of all, I'm really honored to be in such an illustrious gathering of public health champions, true champions, true heroes in the public health domain. I want to acknowledge companies such as Merck, Philips, GlaxoSmithKline, Safaricom, Huawei, Kenya Healthcare Federation, which actually pushed to exactly what President Kim talked about, that we have to resolve issues of inequity where children are stunted, where there is acute malnourishment, where there are issues of marginalization. We have found that going into northeastern Kenya, and thanks to the World Bank, thanks to Norway, thanks to DFID, that we've actually gone into places which are strife-driven, seeing the scourge of violent extremism, and with the highest maternal mortality rates in the world. I mean, they go through the roof of 3,795. Kenya is amongst the 10 most dangerous places for a woman to give birth. But in 2 to 3 years, that has transformed dramatically. And what we've seen is actually pushing into these difficult, hard-to-reach counties. We are actually addressing an issue of inequity. We are addressing issues of culture. We are talking to religious leaders and talking about why FGM and child marriage is a contributor to maternal death. So I think we are at that beautiful moment where actually today we've started a conversation in Kenya where with Philips, where with Unilever, with some governments, and I'm inviting others, that we set up an SDG platform which will have 4 key cross-cutting areas: advocacy and policy change, where the government is actually willing to do things to advance maternal and reproductive and child health. Number 2 is to bring in innovative financing. Number 3 is to look at large-scale public-private partnership, because it is the private sector which will deliver on the last mile. That's the reality there. And finally, this could be knowledge management. So if Kenya can do it, the rest of Africa can do it. I'm quite confident that in 5 years, if we get it right, we can actually achieve universal health coverage in Kenya.
Thank you, and I've seen the incredible work done. Wow. Thank you for that. The gentleman in the glasses, and then the lady behind. And then I'll come to the back of the room. I see you. Thank you.
Thank you very much. My name is Harald Nusser, Novartis Social Business. Let me congratulate you to this great initiative. Coming from a past where we focused in public health on verticals, therapeutic area verticals, like malaria, HIV, AIDS, can I have the hope that linking to non-communicable diseases is possible in those programs when we speak about gestational diabetes, hypertension, for example, that we smartly link the money, the infrastructure that we have built in several verticals for a more horizontal, holistic approach? That would be very, very fantastic. And I just wonder whether this is part of the discussions in your organization, Bill, in the Global Fund.
Thank you. So we'll come to that in a moment. Let's take the lady. And
good morning, everyone. My name is Nneka Mobison. I'm co-founder and CEO of a digital health social enterprise that interestingly focuses on integrated chronic disease management for Nigeria. My name means Nneka, which means in Igbo, the Igbo language of Nigeria, mother is best. So evidently, it's really wonderful to really learn about all that's being done. And obviously, several years ago, we recognized in Nigeria and across Africa that mothers are best. But I'll be frank, I don't think at the private sector, the local private sector level, that we recognize that enough. Last night, I was at an African prosperity dinner. And to be frank, I don't see very many of the Africans that were in that room here today. Yesterday, I was at this investing in STEM research lunch in Africa, because we are really not contributing to that. And there were very few Africans in that room. And I guess my question is, how is the GFF looking at engaging the local private sector resources as well? In addition to the public sector, what is the role in terms of engaging the local private sector wealth that we're seeing? Because without that, we're not going to necessarily achieve the sustainability we want to in the long term.
Thank you very much. We'll address those quickly and then come back to the floor. Yes, Jim, do you want to start? Or Bill?
Bill, on the non-communicable, I'd love to hear what you think about the integrating non-communicable disease delivery.
I think the holistic approach is what everybody's trying to talk about. How do we make sure that we're not dealing with boxes? And there seemed to have been an approach before where, you know, you're dealing with one issue and yet somebody dies of a completely different issue simply because it wasn't on the table. So Bill, what are your thoughts maybe on that?
There are priorities, so that is in health. There are things that have huge impact at very low cost, having to do with first 30 days, vaccination, nutrition. And health systems can't do everything all at once, particularly things that involve doctors. You know, most Africans are going to be born and die and never see a doctor their entire life. That's reality. But what can we do so that they live up to their potential? So you can't do all the diseases, and you know, you need to prioritize some interventions over other interventions.
So that's just practical. That's just the way it is.
Well, until we get more resources. Okay. We do live in a very resource-constrained world. You know, in a place like Nigeria, the primary health care is only getting to about 20% of the kids in some of these states. The salaries aren't being paid, you know, and there's over 1 million lives a year that are lost because of those shortfalls. So when you can do integration, it's great. You know, combined supply chain, there's a lot of good work going on with that right now, where you could train the primary healthcare worker, but understanding how you take finite money, finding training capacity, and pick which things to do is super, super important. And there's a lot of things you wish you could do, but if you could, because of the high returns of the ones that are fairly low cost, you can actually get to a pretty good place, and then the virtuous cycle of good health, good education creates more resources, kicks in, and then you can find yourself even further up on that curve.
Right.
But to take a little step further, you know, Bill's been helping us with trying to think about what are the sort of systems that should be in place for primary health care. So the primary health, it's called the Performance Initiative Index, right? And so ultimately over time, and one of the things we're paying a lot more attention to now than we did before was what are the systems that should be in place so that when the resources become available, you can deliver much more broadly. You can you know, because this is happening. It's happening right now. Non-communicable diseases are becoming more and more important everywhere. And so I think now, especially with the leadership, the Japanese have been very focused on universal health coverage, and it's forced us to ask the question, is it, we've got to put the mechanisms in place to, for example, deliver vaccines. That, you know, you cannot allow that to be threatened because you're trying to build systems in some crazy way. But over time, we're thinking much more about design elements of what would a system look like that could actually deliver, you know, much more broader priorities. But here's the other thing we're thinking about the World Bank Group. If you look at, and all you need to do is just look at our number, go to the website and say, how many jobs will be lost due to automation? Now, nobody knows for sure, but if you look at just our own data, it's pretty frightening how many jobs are going to be lost. Our estimate is 66% of current jobs in India will be lost due to automation, 85% in Ethiopia. Now, for us, what we think is that's kind of an opportunity for health. The role of community health workers has been shown again and again and again and again. And so we're trying to switch the thinking of the finance minister saying, look, don't think about community health workers as another expense around health. Think of it as an employment program that will be the first step for otherwise unemployable people into the formal labor market. And what we know is that if you provide training, not just in the technical area, but in the so-called soft skills. Everyone gets mad at me when I say soft skills. They're not soft. They're fundamental skills and teach you how to become a worker in the system. That when you when you do that, what we're trying to tell them is not only are you going to get better health outcomes, but you're going to get more votes. You're going to get you're going to get more votes, and we can also show that because health outcomes are so directly connected to economic growth, that you're not, everyone thinks if I build a road, it's going to help me grow economically. And they're not thinking if I help to build a brain, it's going to help me grow economically.
Right.
That concept is still not in Ministers of Finance's head. This past fall, Tim and Miriam, the first time in history, Ministers of Finance stood up and said, we're committed to reducing childhood stunting and improving nutrition and doing all. First time we've ever done that, right? So it's getting there, but we have to put all the pieces together. I think that education workers and health workers is going to be a big way to absorb at least some of the job losses that are coming all over the world.
Thank you, Ken. I'll come to you then, and Jim, in just a moment, I'll ask you the question about how to leverage local money in Africa.
Well, I know we are short on time, but I would just say that speaking from an industry perspective, at this meeting at Davos, 22 companies announced what we call accelerating access, which is do exactly what you said. We recognize that the most important thing that we can do is vaccinate children. That's got the huge, most important impact. We also have done a great job on infectious diseases like HIV, but increasingly the burden of non-communicable diseases is important. You go in certain areas in Africa, for example, I'm told that the rate of hypertension can be 75% in communities. And so if we're not able to treat people with hypertension and diabetes and other things that we actually can fairly treat with not expensive drugs, I think that's going to be a problem. So we're going to try to see what we can do as an industry working with others to try to build the kinds of primary care systems that are necessary to deliver on these chronic diseases. But you can't do it unless you build the health infrastructure, because I think that's where you get the linkages across these silos.
Right. So Jim, very quickly, how do we leverage participation, ensure that we're getting funding from local partners, private sector partners across Africa, Asia, and other states as well? What would you suggest?
I don't know.
That's why we are here.
It's a good question.
As part of, yes.
It's a good question, and I don't know. Bill?
Well, there are people like Aliko Dangote who are very involved. He and I do video conferences with governors of Nigerian states to talk through their primary health care system. And is it functioning? Have they assigned the staff? Is the supply chain working? The Masepi family in South Africa is very generous on a lot of these issues. So more people are coming in on a philanthropic basis. We connect with the private sector on some of these issues like supply chain. If the government's good at bidding things out, willing to have that expertise come in, it's been challenging in a number of countries.
But I hadn't thought about it. But I know they coin. Why wouldn't they contribute to the GFF locally? Can we do that, Tim? Why not?
And I think it's
Hadn't
important
thought about that. Yeah.
for those at local level. I'm in the media, whatever space you're in, civil society, we need to focus a light on the issue.
Yeah.
And we need to recognize and appreciate those that are doing things and ask those that are not why they are not getting involved. And I think we have a key role to play in our local spaces. So very quickly, I see a question there. I see the hands at the back. How many do we have? 1, 2, yes, we've got 3 at the back. Okay, we're going to try and do as many as we can. Please go ahead. Thank you.
Gary from BD. I've been following GFF since it first started, and including the meeting in Addis. This may be a naive question, but it strikes me that when we're appealing to the private sector for funding, we're speaking to the philanthropy people, and I wonder if we should be speaking to the Treasury people. If we're looking at this potentially as an alternate investment for things like pension funds. Now, of course, the Treasury people have to be influenced by the CEO and the people who are doing social investing, but that would open up a much larger pool of potential funds from the private sector. One other additional quick point, when we talk about pregnancy, we think women, but in many countries it's more than 50% it's girls, and how we deal with pregnant girls and the higher risk is something that's very important.
Thank you so much. Gentleman in front of you, and then we'll take the mics to the back. Go ahead, please.
Just wanted to thank you, Maria, for inviting me. My name is Ken Hu. I own a startup that develop technology to detect cancer at an early stage, including cervical cancer for young girls. As we're going through FDA approval process this year, we want to be able to help. My question is, what is GFF doing to engage a very small startup like us? Not only that, we believe we can contribute in terms of money. You know, $100,000 considers a whole lot of money for us. Since the Norwegian finance minister's gone, he's $350 million so much.
Yes.
But that's one Norway, right?
We've
Well,
got,
millions.
well, we've
more.
got it, but you can still contribute something. So what's being done? Okay, so let's go right to the lady at the back. Thank you.
Hi, I'm Christy Tanner. I oversee CBS News Digital, and I have both a question and a call to action for everybody in the
As
room.
quickly as possible. Thank
Very
you, Christine.
quick. The call to action is we're looking for stories about gender equality, the SDGs in general, and we want to be able to shine a light, as you said, on this. We can't do it if we don't have great ideas from everyone in this room.
Thank you.
We want to make accessible everything that's being done in Davos to the mass market. My question is, what is the role of technology in financing and solving this issue?
Thank you very much. Gentleman next to you.
Thank you. ASI, now the International Federation of Red Cross and Red Crescent. I don't know the exact number, Jim, but some suggest that up to 50% of preventable maternal and child deaths occur in crisis, fragile, and humanitarian setting, in places where there is no government, in places where there is no doctor, in places where there is no system. But there are local actors waking up every day and then trying to respond to the needs of people. What are the avenues, with systems and mechanisms like this, that can also channel resources, knowledge, as well as, skills, to those actors to respond to the needs?
Thank you so much. Gentleman next to you, and then I'm coming to the front to David for the final question. Go ahead.
My name is Jan-Willem Schijgrond from Philips. I'm also representing the private sector in the GFF Investors Group, and I'm a huge fan of GFF and the work we do with the partners, in particular on the innovative financing, the sustainable business models, so commercially viable, and on the technology and innovation. But what Dr. Kim was saying is that you're talking to governments to increase domestic resource mobilization and invest more in health. What we see is that typically they'll invest about 70% of their budget on secondary and tertiary care and only 30% on primary health care. Are you finding it easy to talk to them to invest more percentage-wise in primary and community-based care than in secondary and tertiary care?
Thank you so much. I will take the lady over there, if you could be 30 seconds, and then to David here to end.
Hi, my name is Joanne. I head up the Center for Global Health and Diplomacy. I had a question how the GFF is working with for-profit health funds like the Abraj and the Saronas of the world.
Thank you so much for that. And we'll take a final question from David Navarro at the front.
Thank you very much indeed.
Thank you.
Just to everybody, I think just please note that there is a new normal starting to emerge, which consists of the following: doing what's the best science, making certain that there is partnering wherever possible, stretching every single dollar to try to get $5 or $6 in, and then perhaps most importantly, investing, as Jim said, in brain building. Just let's hold on to that, because it's actually through moments like this that we can diffuse new ways of thinking and link to Katya's point that this is all about the basis of empowerment. Please do, everywhere you go, diffuse the new normal. Thank you.
Thank you. Wow, that's powerful. Literally 30 seconds. This young lady's looking at me. If I could give her 30 seconds, and we'll have a final 1-minute comment from each of the panelists. Thank you. Very quickly.
Thank you very much. So my name is Laura Sanchez, and what we have seen here is that the governments are enablers of these initiatives. What happens in those countries where the governments are blockers? So I come from Venezuela myself, and there's a humanitarian crisis there. How do you cope with those governments where you can make such a difference, but governments are not collaborating?
Thank you. So I'm so glad I took your question. So Jim, I come to you straight on that, and there were several others related to that. How do you deal with the smaller partners who want to come in and play a role? Over to you, please.
Well, Venezuela's tough. Venezuela is a member of the World Bank Group, but we haven't been operating there. And unfortunately, we're probably going to have to wait till it collapses. And then the thing that really worries us is that you've got this great country right next door, Colombia, who, you know, and President Santos is, in fact, the reason why I was late, because I couldn't get in, he's here, has done such an amazing job. But Colombia is threatened right now. I mean, if Venezuela collapses, but there's just places where it's just very difficult to go, and that's one of the countries. Let me just step back and reflect, reflecting a little bit on what David said. If Tim wants to answer some of the specific questions about private sector, you know, what we're trying to understand, the fourth industrial revolution is real, and we're trying to understand what are the things that we know we can build that won't become white elephants later. And I keep asking my team, are we investing in development in a way that assumes that certain things will happen as it always has, and it won't? You know, are we assuming that it's going to be productive agriculture, light manufacturing, and heavy industrialization in every part of the world, whereas in fact that might not be a path open to many, many different countries? And so I keep going back to saying, what's the one thing that we really know that everyone will need? It's every single neuronal connection you can have. And it's healthy children, it's healthy mothers. So we're trying to now go through and figure out what that is. The GFF focuses on those things that we know that in any situation, any kind of future situation, this is money that is going to preserve the ability, I think, of countries literally to be able to compete.
Thank you,
So
Jim.
That's what I would leave you with.
Thank you. I'm so sorry. Bill, I come to you for your final comments because we must wrap up, and then Ken yourself. So Bill, your thoughts?
Well, GFF involves people with a lot of expertise in healthcare, and absolutely primary healthcare is the priority. The discussions with Tanzania, with Ethiopia, with the key recipients is about their long-term plan. And fortunately, in those cases, the governments are good enough that the money is going to build the long-term capacity of the government at all levels. And it's very impressive to see. Those are, you know, the countries that are setting a good example. We have some, like Nigeria, that hang in the balance, very tough situation, you know, that we're all thinking about, both the finance side and the management side, how that can improve. And most children and mothers who are at risk are in places where the government's good enough that by partnering with them, whether it's India or most countries in Africa, we can make a huge difference. Special things have to be done in a few places like Somalia, you know, DRC,
Crisis,
it's
yes.
a lot of the NGO actors, but you know, there's a very pragmatic set of expertise that takes these very finite, unfortunately, resources and make sure they have high impact, mostly through primary health care.
Thank you, Ken. Final comment.
Close by saying we're pleased to be here to support GFF. I think this discussion has brought out just how complicated these issues are, right? And we talk about health issues as though they're discrete. We know they're political, social, economic, cultural factors that bear on this. And so as a private actor, we're just pleased to be able to work with multiple stakeholders to contribute not just financially, but our own expertise. And I just encourage all of us not to give up hope, because even though we can't solve the problem broadly, each intervention makes a difference in the life of an individual.
Right.
Thank you very much.
Thank you so much. Yes. One more quick comment.
Everyone here, I count on you to go out and talk to private sector players and other donors and tell them about this. Now, everyone likes to leverage others. Nobody likes to be leveraged, right? But what we're saying is, we are saying, please leverage us, right? So let them know that these silly World Bank people, you give them one, they'll give out 5, right? Let everybody know. Thank you.